Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. Our guest in studio is Amy Bell. She's a physical therapist with Athletico Physical Therapy based in Chicago, and she's with us today to talk about a gymnastics and cheerleading program that she founded, how she's still involved with those athletes, and some of her physical therapy philosophies, as it were. Welcome to the program, Amy.
Thank you so much for having me today.
Thank you. Now, you're a physical therapist with Athletico Physical Therapy based out of Chicago. Are you located just in Chicago, or are there some satellite offices as well?
We actually are in 9 different states right now.
Oh, great.
We were founded in Chicago, but we're expanding.
Right. And how long have you been a physical therapist with Athletico?
I've been a therapist for 11 years.
With all of your experience with Athletico?
Yep, all at Athletico at the same clinic.
Right. Now, were you an athlete? Were you interested in physical therapy just because of some personal experiences, or how did your career come about?
Well, I was a gymnast for 20 years, and through that experience, I unfortunately had some injuries. And so I was exposed to physical therapy when I first was 12, and then many more times through high school and college until I retired from gymnastics at age 22. So I was very familiar with the field early on.
And these injuries that you sustained and thereby started getting experience into physical therapy, I mean, were these potentially career-ending injuries, or was it the physical therapy that made it not so?
I mean, I guess I had some serious back injuries, but I always work with great physical therapists who were positive and kind of, let me know that things would get better if I did my exercises and I, followed their advice. And I also worked with many knowledgeable doctors who, gave me hope that things would be okay. And luckily, I was able to have a successful 20-year career in the sport.
Right. Now, as a physical therapist, are there different levels of physical therapist? I mean, are you a junior physical therapist, or are you at the top of the field? Or how far, or are there more for you to go to become a much better physical therapist?
Well, when you come out of school, you have, enough knowledge to be a great physical therapist.
Mm-hmm.
But, obviously with experience and time, you grow your knowledge base and your skill set. And there are advanced specialties that you can pursue if you're interested in doing that, and different techniques that you can become certified in. And you could also go back to school for a PhD if you wanted to teach.
There's a program that you started having to do with gymnastics and cheerleading. Now, you were a gymnast for 20 years. Were you ever a cheerleader at all, or how did that interest come about?
I wasn't a cheerleader ever. It was something that I thought was neat, but as I started being a physical therapist, I realized that a lot of the injuries, they overlapped with gymnastics and cheerleading, and so there was a lot of knowledge that could be shared by partnering the two sports together.
And as far as staff, are you always required to work with a medical practitioner on site, or does your practice stand alone? And as far as referrals, when those referrals do happen from a medical practitioner, how much back and forth is there? Once they refer to you, do you have to keep their doctor abreast of what's going on with them?
Yes, I mean we luckily have the chance to build a lot of relationships with great physicians all around Chicagoland and now in other states. And so then they'll refer their patients to us, and then we'll communicate with them regularly, giving them updates on how their patient is progressing. And then once they're completed with physical therapy, we send them more communication, just letting them know what the plan is for them getting back into their sport.
Now, this gymnastics and cheerleading program that you founded, is this something that is exclusive to Athletico Physical Therapy and yourself, or is this a program that you can give to, say, a high school or a college and say, here's the program, you can deal with your cheerleading and gymnastics staff thusly, as far as physical therapy goes, with your own therapist? How does that work?
So it's actually a program, meaning that there's a network of people. So we have probably 50 clinicians that are part of the program, and we all share the same passion for treating gymnasts and cheerleaders.
Mm-hmm.
And we meet several times a year and share our education and our experiences. And then we go out into the schools, into the high schools, middle schools, private clubs, and share that knowledge with the athletes, the coaches, the parents. I'm teaching them things about injury prevention, nutrition, injury management, just so that they can stay healthy and stay in the sport and not be on the sidelines with injuries.
And what kind of response have you received from folks when they implement your program after having tried some others?
Well, I think that there's a very positive response because one, the program, the Gymnastics and Cheerleading Program is made up of clinicians that have various levels of expertise in being a gymnast or a cheerleader as their background. So right away, we speak the same language as our patients. We can say the different terminology such as, back handsprings or flip-flops and things like that maybe someone who doesn't know anything about gymnastics wouldn't bring up. And we ask them, what level are you? What skills do you want to get back to? And it just right away, it's so neat to have someone understand exactly what you're going through. And I think with our background in being a physical therapist and then also being a gymnast or a cheerleader, it really helps the treatments to be more effective and efficient so they can get back to doing gymnastics or cheerleading as fast, but also as safely as possible.
Where can our listeners go and get more information about Athletico Physical Therapy?
I would direct people to go to our website, which is www.athletico.com, and they can learn all about the different services that we provide. We have so many specialized programs that they can learn more information about. They can learn about our locations and all the different opportunities they have within our company.
Great. Well, it's been a pleasure talking with you today, Amy.
Thank you. It's been great being here.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Amy Bell, physical therapist with Athletico Physical Therapy. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.